Hello and welcome to the Dr. UUT lectures. The point of today's discussion is about thyroid gland diseases, hypothyroidism and hyperthyroidism. The very points that will be discussed in today's discussion with you guys. Well, starting from the very first point, thyroid gland. Gland, it is actually an organ that is present in your neck region. Okay, that is called as thyroid gland. This gland is responsible to secrete some hormones known as thyroxine, thyronin, and calcitonin. The very basic hormones being secreted by the thyroid gland. Okay, now these glands, if secretion is increased, we call the hyperthyroidism, and if the secretion is decreased of these hormones, then we call the condition hypothyroidism. Words are telling you guys: hypothyroidism, hyperthyroidism. Hypo means less, low. Thyroidism, function of the thyroid gland, and hyper means more. Thyroidism, the function of thyroid gland. So if hyperthyroidism is there, so there will be the increase in the release of thyroxine, thyronin, and calcitonin. And if there is decrease in the function of the thyroid gland observed, there will be the decrease in the secretion of thyroxine, thyronin, and calcitonin. Well, that's the point. Now let's go a little bit in depth of the physiology, then in the pathophys, then in the treatment, then in the signs and symptoms, and then in the treatment, and that will be our way to tell you people about the topic. Well, in case of hypothalamus, when the hypothalamus is actually sensitized, so it will release thyrotropin releasing hormone. That thyrotropin releasing hormone will come to the pituitary gland. Okay, these are all in the brain. So in the brain, pituitary gland will be stimulated by means of the thyrotropin releasing hormone, which was released by the hypothalamus. Hypothalamus releases thyrotropin releasing hormone that will come to the pituitary gland. The pituitary gland will then in response of the thyrotropin releasing hormone release another hormone known as thyroid stimulating hormone. This thyroid stimulating hormone is then responsible to move towards the thyroid gland. Why? The name is telling you guys, thyroid stimulating hormone, a hormone that is going to stimulate the thyroid gland. Now when the thyroid gland is stimulated, it will awaken, and then it will start releasing T3 and T4 into the blood. Then what will happen? This released hormone concentration will move towards the pituitary gland, and will tell the pituitary gland, please stop it. Now I'm available in the blood to do my job. Okay, so then pituitary gland will not release TSH, and then no thyroid gland stimulation. When there is no thyroid gland stimulation, then there will be no release of the T3 and T4. That is the point. Well, if there is decrease in the concentration of the T3 and T4 in the blood, pituitary gland will sense it. There is no thyroxine and triiodothyronine coming towards me. Means there is no T3 and T4 coming towards me. What's the reason? This will switch and will release the hormones TSH, thyroid stimulating hormone, that will come to the thyroid gland and will tell the thyroid gland, release it. Release T3, T4 and eat it. Well, then T3, T4 will be released. This is called the negative feedback mechanism. This is the negative feedback mechanism. Okay. So like this, the level will be maintained. Okay. What happens if this level is disrupted? If there is way too much decrease, if there is observation of the decrease in the concentration of T3 and T4 in the blood, we call that condition as hypothyroidism. And we have primary, secondary, tertiary, and quaternary, means 4 types of the hyperthyroidism. The very first one, due to some diseases, primary hypothyroidism may be seen due to some diseases and due to some therapies. Means you are taking some of the therapies and they may cause you hypothyroidism. Okay. In secondary, there is actually the pituitary gland. In some people, pituitary gland is not functioning. And in the tertiary, we have hypothalamus. In some, there is the case of in the hypothalamus. So hypothalamus may be disturbed, pituitary gland, and due to some other therapies, your gland may be disturbed. And we have the quaternary one. And the very fourth one, the quaternary one, is called as subclinical hypothyroidism. Now what is actually seen in this case? Very simple. When we take the lab test, we get TSH and T4. T4 is normal, but TSH is elevated. And when we go for the further understanding, for the further diagnosis, thyroid gland is okay and pituitary gland is okay, nothing is happening. So this condition is called as, actually the patient is having quaternary type of the hypothyroidism. Okay, this is called as quaternary or subclinical hypothyroidism. Well, now what are the signs and symptoms when one gets the hypothyroidism? Fatigue, the very first one, will feel tired. Depression will be the observation, and cold sensitivity means the person with the hypothyroidism will be having cold sensitivity even more than those who don't have hypothyroidism. And weight gain, unintentional weight gain may be observed in constipation and puffy hands, face and feet, and sleep problems will be disturbed, and libido, okay, low mood for the intercourse, and laxedema and coma at the end. So I have just put all the early stage and late stage symptoms and signs on the board for ease and understanding. Okay, well, we have then treatment for this. Levothyroxine is the best one. Then we have leothyronine, but levothyronine is not actually used as the best one, but this may be used when there is actually persistent sign and symptom observed even when the patient is using levothyroxine. Well, there is another discussion and further more discussion available for the treatment of the hypothyroidism. This is actually the very basic, and that is actually for you guys to write down in the examination to pass your this particular topic. The point is actually about the hyperthyroidism. Hyperthyroidism, when there is increase in the level of the thyroid gland secretion, that is increase in the level of T3 and T4 hormones in the blood. So in this case, what will be the sign and symptoms? Simple. Sign and symptoms will be just opposite of the hypothyroidism. In that we had cold sensitivity. Here will be having opposite, means sweating will be observed, means increase in sensitivity of the heat sensitivity. And there we had weight gain, and here will be having weight loss, increase in the heart rate, increase in the temperature. There we had depression, here will be having anxiety. So these will be the signs and symptoms, and for the treatment point of view, we have here methimazole and PTU, propyl thiouracil, and some beta blockers and etc. Some half atomic can be done of the thyroid gland when it is required. Okay, so this is all about the hypo and hypothyroidism from my side for your exams, and I hope you just got the understandings of the hypo and hyperthyroidism. Thank you for watching Dr. UUT lectures.